Okay, I'd like to start by first acknowledging that I'm sitting on the lands of the Mi'kmaq territory and the people, also the ancestral and unceded territory of the Wabanaki Confederate, the Passamaquoddy, and the Abenaki, and I thank them. And just to give you a little bit of context, and I see a fellow community developer on there from BC, so hey, as well as Karine with Vitalité is on the line as well. So for Horizon Health in New Brunswick, for those who aren't as familiar with how New Brunswick's established, we have an Anglophone and a Francophone health authority. So the Anglophone authority is Horizon Health, and the Francophone authority is Vitalité. And while both authorities provide service in the language of choice for patients, we just have an operational difference in our language. So just to clarify. And my role as a community developer, I work within the population health team, and we focus on using the social determinants of health as our framework. So once we consult with our communities, which I'll talk about our process here a little bit today, the community identifies their priorities, and then my role as a community developer is to take their priorities and that information, and then that really forms the basis of my work plan. And really my role is to convene partners to ensure that the voice of community is heard and incorporated into planning. And I'm also one of the few positions that have the luxury of being outward focused. So my whole job is to be out in community. And I do recognize that as a luxury because most positions in the healthcare system tend to be facility focused and individual patient focused, which makes it harder to do this community engagement work. So I am very thankful that I get to play that role and attend meetings and meet all the amazing people. So I just wanted to start with a little bit of a graphic, and I don't know if this feels familiar to a lot of people, but one of the interesting things that I always find is that when someone, whether it's in management or a funder, gets an idea of engaging with the community and designing a community-based project, they very much feel like it's a straight line. No issues. I'm giving you the project and off you go and do it. They don't always understand or appreciate how much work is required to execute, especially if those individuals don't have experience working at the grassroots level or in community. So they very much see it's like in a facility type environment, not to say that there aren't, challenges there as well, but it's very much, here's your piece of work, we would like it done in 3 months and off you go. And they don't always recognize, excuse me, that just forming those relationships in an authentic way can take 6 months. So the reality is definitely the ups and downs and the highs and lows, and anyone who works in community, I'm sure, recognizes that and feels it very much. And one thing I always remind people when they're just coming out and just starting to work in partnership groups and collaborative groups, sometimes when we take courses in university, we don't always keep a lot of that information with us, but one of the pieces of work that I always keep with me and actually share with people are the stages of kind of group dynamics, and recognizing that every group or every new team of people has to go through the 4 stages of storming, forming, norming, and performing, and you really can't jump any of those steps. And even if they're groups of people who are used to working together in one capacity, sometimes when we introduce new partners to the table or when we slightly change our focus, we do have to allow time for those group dynamics to form again and to reestablish. So one of the big pieces that I like to share and talk about is that if we really want to engage community and if we want to engage them to focus on inequities or building a more equitable system, we really need to look at how we set the table. And for many people, This one is a bit of a challenge on both sides of the equation because we're asking people to get out of their comfort zones. So typically in a lot of organizations, most of the power and decision making is concentrated at a boardroom table. And from my perspective, we really need to change the table that we set and move it more to kitchen tables. And in some instances, some groups are actually physically changing the table, which I think is amazing. I know I'm very loosely connected to a project here in St. John, New Brunswick with social pediatrics, and that whole model of care is actually designed around the kitchen table. So the first piece of furniture they bought was the kitchen table, because if we're asking community members and individuals who haven't necessarily had a welcoming and positive experience with the system, then a boardroom is not comfortable and appropriate for that. But everyone has sat at a kitchen table before, hopefully, and that automatically makes people feel a little more comfortable because it's a familiar setting, and the power dynamic shifts around a kitchen table as opposed to a boardroom table. You know, one of the pieces that I've had to learn, because I love change and I'm used to working with community, and I also have to take time to pause and recognize that for the typical management individuals or the key leaders working in community or going to sit at a kitchen table with community members where they're not perhaps used to the process or the group dynamic of that team as well, we have to recognize and give time for those individuals to acclimatize as well. We tend to focus strictly on community members kind of coming up to the boardroom level, but it really needs to be a two-way street, and we do need to recognize that it takes time for everyone to get comfortable and everyone to stretch a bit and get outside their comfort zone, because that's really how we can move forward with encouraging community engagement. One of the pieces that I wanted to talk about today, and it's nice because with Nancy, who's going to talk a bit more about individual level engagement and working with individuals in that way, I wanted to take a few minutes today and talk about Horizon Health's way that we ensure that the community voice is heard and incorporated into our planning. So we actually have a formal space or a formal process to have community voices involved, and we're legally required to consult with communities in New Brunswick. So Horizon Health has chosen the method of a community health needs assessment. So every 5 years we have a team internal to Horizon that comes out to consult with community. And for us, when we say community, it's typically a regional focus, because like a lot of places, our communities are quite small. So we would tend to look at a regional voice as a community voice. And this team comes out, and basically what we do is we seek out and encourage individuals representing demographics of focus. So for example, seniors, newcomers, people with lived experience, first voice stories. We want to make sure we have those individuals engaged and at the table. And then we work with them through a process of about 6 months of understanding the demographic information that we have. Does that make sense? Does that feel like their story? And then we lead them through a process of assigning what their priorities actually are. Every executive leadership meeting or board meeting, there is a standing item so that we have to report on the progress of the community health needs assessment. So we actually have set time with key leaders to ensure that we are continuing to focus on those priorities that the community has identified. And I will say that it's so nice and rewarding to be able to push up the good news stories that we have, because for us to execute these community priorities, we really have to work in partnership. And the only way we can work in partnership is if we're truly engaged with individuals and meeting them where they're at and being truly and honestly authentic. The next little cartoon I have is really just focusing on the fact that engagement is truly rooted in open and honest communication, but sometimes when we say that, we can have a bit of a muddy perspective because there's differences for those individuals who are experiencing the situation versus those who are observing the situation. And we never have a homogeneous group of people in the community when we're doing this type of work. So it's always interesting to kind of hear two takes on the same issue or even the same statistic, because it's always looked at through our own biases, our own context, and our own lenses. So that can sometimes cause a bit of friction because we all think we're looking at an apple and we're all calling it an apple, but someone might see a Granny Smith and someone might see a Golden Delicious. So we have to remember that we're looking at things through our own lens and our own experience. And it's important to recognize and value that and not just stop listening because what we're hearing is different than what we're seeing. I next wanted to just highlight some of the key elements of community engagement that I've learned over the years. And the first and most important one that I share with anyone is that you need to be there before you're needed or before you need something. So if I've been in instances where someone will want to do a project and consult with the community and they're like, well, they need to be here next Tuesday, but there's been no advanced preparation, there's been no connection, and it's made it very difficult for them to build trust and understanding. So you really need to be there well in advance. You need to put the effort into developing the relationships, walking the streets with the individuals where they live. If you're fortunate to get invited into homes, that's amazing. Spending time at, the schools and the community bumping points or the spots where people naturally gather. It's important to be there that they can start to trust you and accept you as part of the community before you start asking them for anything, because there is a high degree of suspicion from some communities, and understandably so, when all of a sudden someone parachutes in and starts asking questions. So you really need to be there in advance, and you do need to put the time in. I know that for some reporting structures and some management systems it can be hard because not everyone sees that as an output, and some people are managed to outputs instead of outcomes. But I would encourage, if you're having issues like that, to have discussions with your management to really help them understand that that is the most critical piece to provide the most honest voice to guide the work that you do. Another piece is to truly and authentically meet people where they're at. And that can include everything from being in their space if they've invited you in. That can be meeting them at 7 o'clock on a Saturday or after a church service on Sunday. And you also have to really focus on understanding where they are at. So sometimes when we start engaging with individuals, especially in the healthcare system, if they haven't had the best experience, there can be an anger around something that may or may not have happened, or a feeling that they're not valued, because some healthcare professionals like to use the word non-compliant when people don't do, what the healthcare provider has asked them to do. And when we use that language like non-compliant, it really puts that power imbalance in place. And personally, that's one of the things that drives me crazy about the system. So if we're really meeting people where they're at, and if we're being authentic, it's not saying that they're non-compliant, but it's working to understand why someone couldn't carry out the actions or the steps that you've asked them to do. And that also means dressing appropriately for where you're meeting them, and having food available and a safe space for people to be available, and being comfortable with perhaps colorful language if that's part of it. That's really engaging with people where they're at and how they want to be engaged. Another key point is really being honest. You want to talk about what we can do, what we can't do, and if there's been mistakes, admit them. There's nothing worse than engaging with a population especially one that hasn't always been treated the best by the system, and then they have an expectation, and we've maybe helped them down the garden path thinking that that would be something we could do when we never really had permission to do that in the first place, or there wasn't any way that the government system is going to change that way. So we need to be honest about, what are the realities? What can we do? There are limits, so state them up front. Also being transparent, communicating with everyone at the same time and in the same way is so important. There's nothing worse than being that one person left off an email distribution list. I think we've probably all felt that a time or two. So that's with a group, for example, that we're maybe seen as peers. And if we're working with a community group, there are disparities and there are power imbalances. So imagine if you're that one person left off of a communication list, or you find out half of the group has already received the information. So it's really important to be transparent. If we're running into issues, show them, state them. That way people can get involved and start working collectively to resolve the issue so that we can move forward. Another really important piece is focusing on following up and following through. So if we've said to a group that we're going to implement a new service delivery model in 2 months, then do it in 2 months. And if you can't do it in 2 months, proactively talk about why and what the new plan is moving forward. The other big piece is when we talk about follow through, we really have to focus that a lot of the individuals we're working with, the issues that we're talking about impact them directly. So if we're talking about, for example, how we deliver social programming, and if you're consulting with a group of individuals who receive social assistance, you're talking about money in their pocket and food on their table. So it's so important that if we talk about making a change, that we can move forward together, and just remember their passion is there, and that they're so passionate because they are focusing on what it means to them. The other piece is recognizing and valuing their community members, and I have a little dollar sign there because we're so good at paying consultants tens of thousands of dollars to guide a process, but our key clientele that we're trying to engage with, sometimes there's issues with giving them a Tim Hortons gift card for recognition of their time, and that follows into the part 2 with removing barriers. If we ask about money for childcare or transportation, sometimes funders will say, well, we can't fund those things, but if we really want to get community members engaged, we have to value their time and we have to remove their barriers. The 2 last points I wanted to make are really don't ask for input unless you're prepared to do something about it. There's nothing worse than, again, getting people excited and then nothing happening. And action will breed more excitement. So if you can actually make an action, maybe it's a small one, then that will get people more excited and they'll be a bit more focused on moving forward with something new. And the very last point, and to me it's the most important point that I want to make on this slide, which we sometimes forget, is people are the experts in their own lives, in their own communities. So there's nothing worse than going to a community and saying, oh, no, I know what you need, or we know what they need better than they do. We don't live another person's life, so we don't have the right to tell them what they really need. It's a collaboration and we need to work together. So the last 2 points that the last slide that I really wanted to show was, again, just a little cartoon. And it's really talking about and demonstrates, I think, probably a scenario that most of us have experienced, where we talked about all kinds of problems and challenges, but never actually moving forward and solving them. So there's always opportunity and money for studies and more studies and more studies, but we have challenges sometimes with really putting some of those resources into action plans. And most of the individuals that we work with, they've been questioned and studied to death. They just want action. So if you are working in a system or an organization or with a group of people that talks about doing a study, really think before you start. Has there been a study done already? Do we have enough information to actually start implementing something? And perhaps instead of doing that, could we take a bit of money, demonstrate some action, and get our community members excited and moving forward? Because that really is what builds their engagement, and that's how we can work forward with health inequities.
Oh, Heather, that's really amazing. You know, I really appreciate the approach that you have with, you know, meaningfully bringing that feedback forward. And whenever I think of you and your work, I think of two things you said to me that have really stuck and that I've passed on. You said one of them earlier, that concept of be there before you need something from them. So before you want to study them or before you want to get their feedback, you already need to be part of that community. And that has really stuck, and that's been helpful to other people. The other thing you've said to me at some point is the concept that we need to shift from being, and I'm not sure if you said it today, but the concept that we need to shift from thinking that we're providing service to and that we're in service of our community. We're in service with our community. And there's something different there, and it's changing how we see our role. We, the broader public health, we see our role in being with the community. So thank you very much for that. And with that, I am going to ask Nancy Stewart to come on and share a bit about her work. Nancy?